comment that Carolyn Raleigh put in the chat box. Modifying therapies, not curative. Hydroxyurea, oxbrita, adavocate, Indari, RBC, red blood cell exchange. The curative ones is bone marrow transplant, gene therapy, and gene editing.
Right. So yeah, so gene editing, the actual sickle cell mutation is curative, right? The bone marrow transplant is also curative. Bone marrow transplants are also tough, right? They're sometimes your body doesn't. So here's the difference between bone marrow therapy and this kind of therapy, right? Bone marrow, you're getting someone else's cells, right? When the body recognizes someone else's cells, it starts to it says, okay, this is foreign. I've never seen these cells. And what will happen is sometimes the white blood cells, your own body's white blood cells, they will attack those cells. So bone marrow, and it's a hard process, but yes, it is curative, right? And with sickle cell disease, it's your own cells that you're getting. You're not getting from someone else's cells, right? It's your own cells. I think the immune part is really important as well, because when your immune system recognizes something that's foreign, it will attack it, right? So that's what happens with COVID as well. Is COVID is such a strong virus, is that your immune system overcompensates and it goes crazy. And it's called a immune response syndrome, right? And people who often die is because of hyperimmune activity. So it's a major also thing that people have to keep in mind. So like I said, every therapy, every kind of therapy, right, medication or gene editing, they have their ups and downs. And I'm just here to tell you the negatives and the positives, right? That's it. And I'm just trying to educate you through the process. I'm not saying go get gene therapy. That's not my job here, right? I'm also an advocate, right? I was raised in a low income population myself, and I saw things, going through Medi-Cal that was really rough, and that's why, with sickle cell communities, that's something that I have common. And that's why I work with people living with sickle cell disease, because we've gone through some same experiences. So that's what brings me close. So I'm not here to tell you, okay, look, this is go get this done, right? That's not my job here. Just wanted